This is the case of Micho. Micho is a 9-year-old seal-point Siamese feline that developed a large interscapular mass over the last month or so. The referring veterinarian did cytology of the mass, which came back suggestive of a sarcoma. On physical exam, a very large, firm, and fixed multilobulated feeling mass is felt in the soft tissues between the scapula. No other abnormal findings were seen on the physical exam, and blood work is also normal. This is a video of the pre and post contrast CT examination of the thorax and interscapular region. Note the large mass seen between the scapula dorsal to the spinous processes. The mass demonstrates heterogeneous, moderately contrast-enhancing, rim-like enhancement. These are static images of the same region. The image on the left is non-contrast enhanced and the image on the right is contrast enhanced. The image on the right shows evidence of, again, moderate, heterogeneous, and somewhat rim-like contrast enhancement. Also note that the mass is multilobulated. This mass measures approximately 5 centimeters laterally and 3.4 centimeters dorsal to ventral. These two images are of another section of the mass, again in both pre- and post-contrast sequences. On close examination, the spinous process appears to be lytic and radiolucent, indicating the mass is invading into the spinous process at this site. The sagittal reconstructed images are also helpful to localize the mass. Note that the spinous processes ventral to this region also appear to be somewhat ill-defined and radiolucent, indicating probable bony involvement and lysis of these adjacent spinous processes. A true-cut biopsy of the interscapular mass confirmed a soft tissue sarcoma, and a vaccine-induced fibrosarcoma was suspect based on the mass's location. This tumor was surgically debulked, however the margins were not clean. Incidentally, these tumors tend to recur even if clean margins are suspect and are extremely locally aggressive. Rarely do these tumors metastasize to distant sites. After surgical debulking, Micho underwent a 21-dose course of external beam radiation therapy using a 6 MeV linear accelerator. Unfortunately, 1 month later, Micho was lost to follow-up.